Hi everybody. So today we're going to talk about lipids or fats, lipids in heart disease and lipids in cancer. Although I've crossed out this bottom part that says lipids, dietary lipids and disease risk, because honestly I'm not convinced that there's a specific fat or fat component that affects risk for cancer. But I do believe that it might be a marker for a lifestyle and a diet that puts you at risk for developing cancer. But we'll talk more about that. What we're looking at on the left is a cross-section of a person's artery. Two on the top are pretty clear. Maybe when you're born, your blood vessels are that clean. And then you start to accumulate some plaque, which we'll talk about in the next few slides. But this amount is considered normal. However, when you start getting your blood vessels clogged with this plaque, like the two on the bottom, that is an incredible increased disease risk. The one on the bottom shows that there's barely enough room for blood to get through. And if a red blood cell or a platelet got stuck in that little tiny hole, if that was a blood vessel that was supplying essential blood that carries oxygen to the heart, the person would have a heart attack. If that blood vessel was supplying the oxygen that the brain needs, that person would have what's called an ischemic stroke. And we'll talk more about plaque. But heart disease is the #1 cause of death in the United States. Actually, I would say, and if we look at the graph here, heart disease and cancer kind of go back and forth. The good news is, well, if you have health care and support, that you can live for a long time with these conditions and you don't have to die young from them. Myocardial infarction and stroke risk increase with what's called atherosclerosis. And atherosclerosis is the buildup of that plaque, that gunk, to use the scientific term, if you will, that builds up inside your artery wall. Ultimately, if we go from left to right, we have two healthy vessels on the left, and it builds up and starts occluding the arterial blood vessels until ultimately blood can't flow. It forms from what's called arterial wall injury. And this plaque contains cholesterol, specifically what's called oxidized LDLs, platelets, calcium. It contains a number of different components that can build up in the blood vessel wall until it finally cuts off blood flow. On the left is a picture, a long view of an artery. And what you're supposed to know is that the red in there are red blood cells and the yellow is plaque. So we're looking at an artery. If we go from top to bottom, what you should be noticing is that the plaque is becoming thicker and thicker or more occluded. And again, it looks like the blood flow is going to be stuck, that a red blood cell or a platelet, which is another type of cell that flows in the blood, gets stuck. And again, if that's blood flowing to the heart that gets cut off, the person has a heart attack. If that's blood flowing to the brain, that person has an ischemic stroke. And a risk factor for these two is called hypertension or high blood pressure. It's a leading cause of arterial wall injury, because what's happening is as your blood pressure increases, as the blood flows at a higher pressure through the blood vessel, it can injure the blood vessel wall. That can cause arterial pressure. If we look at these three words down here, if you pick anywhere you want to start. Let's start with hypertension, high blood pressure. The pressure at which the blood is flowing through the arteries can cause a tiny amount of damage on the arterial wall. But what happens is the body recognizes that as an injury, like you cut yourself. The thing is that when you cut yourself on the outside and you have a scab, that will eventually heal and it'll go away. But if you have hypertension that's not treated, what happens is that artery wall continues to be damaged. And that response to the damage is plaque buildup. And unless you treat the hypertension, then you're going to continue to damage the blood vessel wall and you're going to continue to have a buildup of plaque. These are the blood pressure guidelines that were updated in 2017. You can just have a look at them. What I want you to know is systolic refers to pressure in the heart as blood flows into the lower chambers. That's systolic, and then diastolic is the pressure of the blood flow leaving the lower chambers of the heart. And blood pressure is measured in systolic over diastolic. Optimal blood pressure is less than 120 over 80. What was different about the 2017 blood pressure guidelines was that they eliminated pre-hypertension. They now call it elevated hypertension. I'm not really sure how that affects the standard of care. It's still a red flag, but it's also one of the symptoms of metabolic syndrome. So not only does elevated blood pressure put you at risk for heart disease, but it can also be one of the factors that increases your risk for diabetes. Then we have stage 1 and stage 2 hypertension, and hopefully never a hypertensive crisis. I used to check blood pressures in class. I have a blood pressure cuff, and so part of the activity would be to check folks' blood pressure. Unfortunately, every now and then I would get a high number, and I couldn't do anything about it. I had a student once whose blood pressure was 170 over 90. There's no way that that's normal, even though the young man looked at me and said, "That's normal for me." There's no way that kind of blood pressure is normal in a young man or an older person. And the thing is that it's possible to have a random high blood pressure. Sometimes I'm sure my blood pressure goes up, like the 4th time I'm recording this video lecture. But it's the rate at which it comes down that is related to risk of heart disease, or of hypertension, sorry. So blood pressures can go up and down throughout the day. That's normal. But if they go up and stay up, that's when you're at risk of high blood pressure. So this young man who told me his normal blood pressure was 170 over 90 was terribly wrong, and that's when I stopped checking blood pressure. There are different ways to lower your blood pressure. Probably the one you've heard as most popular is getting salt out of your diet. And that can help. The thing is that most of the salt in our diet doesn't come from adding it at the table. It comes from buying packaged food, and I'll talk about that in a second. The study called the DASH diet, the Dietary Approach to Stop Hypertension. And this study involved people with mild hypertension consuming 9 to 14 servings of vegetables and fruits a day. And it was shown that this diet, when folks followed it, were able to lower their blood pressure as much as the medication they were on. In other words, they were able to go off medication. Now, please don't encourage family or friends to start eating more fruits and vegetables and go off their medication. Don't do that. They have to be under medical care. They need to be seeing a dietitian, and they need to talk to their doctor. But what this study showed was that it wasn't perhaps that we get too much sodium in our diet from salt, but that we aren't getting enough calcium, potassium, and magnesium. And these are minerals that are found in fruits and vegetables. The original DASH diet was low in fat, but there is some data suggesting that you can, if your weight is under control, have a higher fat, fiber-rich diet, moderate in protein and carbohydrate, with 9 to 14 servings of vegetables and fruit a day, and still lower blood pressure. You can also increase your aerobic activity. When you exercise, it strengthens the heart. The heart is a muscle, and using it helps to strengthen it. And a stronger heart is able to pump the same amount of blood throughout the body at a lower blood pressure. And also maintaining a healthy body weight. Now, healthy body weight is different for different people, but when you are overweight or extremely overweight, for some individuals, that puts a lot of stress on the heart. So for some folks, lowering their weight into a healthy range, and that's something that you would talk to your doctor and dietitian about, can help to reduce blood pressure.